Pulmonary hypertension is defined as a mean pulmonary artery pressure greater than or equal to 25 mm mercury at rest. Normal pulmonary artery pressure is 8 to 20 mm mercury at rest. If the pressure in the pulmonary artery is greater than 25 mm mercury at rest or 30 mm mercury during physical activity, it is abnormally high and is called pulmonary hypertension. The pulmonary circulation starts with the right ventricle. From the right ventricle, blood is pumped through the semilunar pulmonary valve into the left and right main pulmonary arteries, one for each lung, which branch into smaller pulmonary arteries that spread throughout the lungs. The oxygenated blood then leaves the lungs through pulmonary veins, which return it to the left part of the heart, completing the pulmonary cycle. Pulmonary hypertension most commonly develops as a result of left heart disease. Here, the pulmonary blood vessels are normal and undamaged, but the left side of the heart is unable to pump efficiently. This causes a backup of blood in the pulmonary veins and capillary beds, which can increase the pressure in the pulmonary artery. Additionally, hypoxic vasoconstriction can cause pulmonary hypertension. If there is an area of the lung that is not receiving much oxygen, it is in the lung's best interest to shunt blood away from this area to a region of the lung where it is more likely to be oxygenated. Hypoxic vasoconstriction accomplishes this. In areas of the lung where oxygen tension is low, the blood vessels constrict so blood will go elsewhere. When there is one area of isolated hypoxia, you can see how this mechanism would be helpful. But if the whole lung suffers from hypoxia, like in the situations of high altitude, COPD, hyperventilation from restrictive diseases of the lungs and chest wall muscles, then all of the blood vessels of the pulmonary vasculature perceive hypoxia and they will all constrict. This is obviously maladaptive and can result in pulmonary hypertension. Another cause of pulmonary hypertension is chronic thromboembolic pulmonary hypertension, which is when there are recurrent blood clots in their pulmonary vessels. The clots can form because of an underlying clotting disorder and can embolize or travel to the lungs. The clots can block pulmonary vessels, which increases the resistance to blood flow, and they can also endothelial cells in the vessels to release histamine and serotonin, which constrict the pulmonary arterioles. Together, the blockage and the narrowing of the blood vessels cause a rise in the pulmonary blood pressure. Regardless of the cause, once there is pulmonary hypertension, it has important consequences on the lungs and the heart. Fluid can start to squeeze out of the blood vessels in the lungs and can get into the interstitial space. The presence of excess fluid in the pulmonary interstitium is called pulmonary edema, and it can make it more difficult for gas exchange to happen. Pulmonary hypertension also makes it a lot harder for the right ventricle to pump blood, and over time, it hypertrophies. This helps in the beginning, but eventually, the muscles of the right ventricle get so bulky that their oxygen demand exceeds the oxygen supply, and it can lead to right-sided heart failure. When chronic lung disease causes right-sided heart failure, it's called cor pulmonale. Right-sided heart failure causes blood to get backed up in the venous system, and this leads to elevated jugular venous pressure, fluid buildup in the liver, causing hepatomegaly, and fluid buildup in the legs causing edema. Also, right-sided heart failure means that the left ventricle receives less blood, and to compensate for that, it has to pump harder and faster. Pulmonary hypertension can lead to severe shortness of breath. When pulmonary hypertension is caused by left-sided heart failure, there can also be orthopnium, which is when the shortness of breath is worse while lying flat. That happens because lying flat pulls more blood back from the veins into the heart, and extra blood only increases the hydrostatic pressure in pulmonary capillaries.
Do not forget to like the video and subscribe to our YouTube channel.